Say about HIV. I want to point to the slide, title slide over here, where you can follow the discussion at Red Pump Project. And so it's Red Pump Proj, and also at CBCF Inc. You please use the hashtag ALLI, which is AALI, standing for Act Against AIDS Leadership Initiative. And then also the hashtag for the conference today, which is CBCF ALC 2012. So again, welcome. This session is brought to you by the Congressional Black Caucus Foundation and the Act Against AIDS Leadership Initiative partners, which consist of 19 civil rights and social justice organizations, and we'll hear a little bit more about them later. This afternoon, we brought together some of the nation's most prolific leaders in public policy, community health, and social justice. Our vision for this session is to encourage a dialogue about Black health that spans the history of our involvement as African Americans, the current state of the Black community health, and promote and continue to promote dialogue and commitment to the end of HIV/AIDS in the Black communities. I encourage you to be active participants in today's discussion with our panelists who are sure to ignite and reignite your fire to fight this epidemic. You can listen, you can share, and most importantly, you should leave the discussion ready to expand the conversation and fight in your local communities, because our Black lives depend on it. And this is not going to be your talking head session. Our presentation today will begin with our wonderful moderator, George Curry. But before we even start that, I want to bring up a filmmaker that I was introduced to just by her documentaries that I watched on PBS, and saw that she was doing a documentary about HIV/AIDS and Black women in the South. Doing this work for the last 4 years, that is something that we all really need to pay attention to. It is an epidemic. It is serious business. HIV/AIDS is number one, or AIDS is the number one killer of Black women in the South. And number 3 leading killer of Black women nationally. It is preventable, and we should talk about it. June, please come up.
Hi, I'm not going to do a lot of speechifying because there's a lot of people here who are way better than that than me. What I'll say is about 4 years ago, I was in South Carolina and I picked up a magazine and I found a story written by a 13-year-old girl who lived in a trailer at the end of a dirt road in a rural county in South Carolina. She wrote about how hard it was to live as a teenager born with HIV, not having many friends at school, not being able to figure out how to negotiate relationships when all her girlfriends had boyfriends, being sick half the time from the side effects of the drugs that she had to take. And I got in a car and I drove out to the trailer where she lived, and I've spent the last 3.5 years getting to know her and her family. And I'm going to show you just a few excerpts. It's actually a 3-minute excerpt because nobody has time to really get engaged with things. I've been following in South Carolina. One of the first shoots I did was a Congressional Black Caucus Town Hall, and there was a woman named Bambi Gaddis, who many of you know, who runs the South Carolina HIV/AIDS Coalition. This excerpt will begin with her, and then you're going to meet the 13-year-old's grandmother and her mother. Her name is Deshal, and her grandmother is Wilhelmina. And I think all I'm supposed to do is hit play, right?
The face of AIDS has changed. It is African American. It is people of color. So when you look at these numbers, what you see in short is that 74% of the cases in South Carolina are African American, that we are first, despite popular opinion, we are first in the country in the rate of heterosexual transmission, male to female. And then finally, we rank 3rd in the proportion of African Americans with HIV and AIDS.
Don't be too proud if you ain't got something. You can get up off your butt. Don't care what kind of work you got to do. Just make an honest living. It's just a lot of family here. And then one day I guess I'll be out there.
And where's Tony gonna be?
Tony Dane is over here.
This is Tony, Wilhelmina's daughter, who was in the end stages of AIDS last July.
How you feeling, girl? Oh, look at her, Mama. Hey, Tony. Hey, Tony. Mama here, Daisha here, and Harry here.
We put up with a lot of Tony. Tony was Tony, you know? This is my daughter, Tony. She's on drugs, she's HIV. It's up to you if you want to deal with her, and it's up to you if you don't want to deal with her. But me, I gotta love her in spite of. I love Tony, I love Daisha, but I just feel like Daisha got the short end of everything.
And Father, in my last days, I didn't know her needs. They took her away from me. I wanted to be the one to take care of her until the end, Father. I had told her these things over and over, even when she rebelled against me. She knew I was there. Please, God, save my soul.
Hey, that's it. Tony died last July.
The face of AIDS has
Whoops,
changed.
sorry.
It is African American. It is people of color. So when you look at these numbers, what you see in short is that 74% of the cases in South Carolina.
There we go, sorry. Tony died last July. She had a niece who died 3 weeks after her, also of HIV. Daishal is still living, her daughter is still living with HIV. This family has 3 other members who are HIV positive. None of them got it in the same way. I've heard a lot of statistics today, and I just want to leave you with 2, 50%. 50% is the number of people who live with HIV who rely on Medicaid in order to get any kind of access to medical care. 50% is also the number of people who live in the governor's home county of Bamberg who tested HIV positive at a recent event where I was. 50% of the young men, young black men, ages 14 to 21, tested positive for HIV. Where are we?
Good afternoon, everyone. Good afternoon, everyone. Let's wake up. Good afternoon, everyone. My name is Mike Henson, and I have the honor of serving as co-chair of the Act Against AIDS Leadership Initiative with Deborah Catchings-Smith and Tony Wayford. The Act Against AIDS Leadership Initiative is a $16 million 6-year partnership between the Centers for Disease Control and leading national organizations representing the populations hardest hit by HIV. We are civil rights organizations, we are social justice organizations, we are membership organizations, we are LGBT organizations, we are Black and Latino organizations. Allied partners conduct a wide range of communication, mobilization, and outreach activities. Some of the examples of our work include holding education and training sessions on HIV prevention at national and regional membership conferences and conventions, training and funding local chapters to implement community-based HIV prevention in their local communities, working to educate national, state, and local policymakers and community leaders about the role of HIV prevention in advancing the well-being of African Americans, Latinos, gay and bisexual men of all races. The sizzle reel that you're about to see highlights some of the work that our members are doing around the country.
That's why my administration is launching a national HIV/AIDS strategy that's going to focus on reducing HIV infections, increasing access to care, reducing HIV-related health disparities. Here at the Department of Health and Human Services, as well as the Centers for Disease Control and Prevention, launched Act Against AIDS programs, which are designed to stress the need to control the disease and the importance of individuals getting tested.
The Act Against AIDS Leadership Initiative, also known as ALLY, is a partnership between CDC and leading national organizations representing the populations hardest hit by HIV and AIDS. ALLY organizations have a strong history of confronting issues that impact our communities, from civil and human rights to health equity, to poverty and education. And now we are joining together to combat the devastating effects of HIV and AIDS on our communities.
We are dealing with a disease which is entirely preventable. And what we are seeing now, this crisis, does not have to be the reality. Everyone and every action counts. And if we are going to be truly successful in bringing this epidemic to an end, we are going to have to end this in the hearts and minds of the nation, of communities, and of individuals across the country in bringing this disease to an end.
HIV has such a major impact on all of our lives. HIV/AIDS is a social issue, not just a health issue.
We can no longer allow our young people to grow up in ignorance. We can no longer allow our community to live in ignorance when there's a disease out there that's completely 100% preventable.
When you think about this particular issue, it is an issue that has not only been there for years, but is especially growing in terms of its negative impacts on our community specifically.
ALLY organizations are using our collective strength and influence to increase HIV/AIDS awareness, prevention, testing, and action by incorporating these strategies into our day-to-day activities within the communities we serve.
Working toward combating this devastating disease that's taking effect on all of our communities. We feel that this is a basic human right and that the attitude is one that needs to be extended, that was part of the movement that birthed our organization in the 1960s to begin with.
Straight to the point, we need to work collectively. We need our bodies, our organizations working collectively.
ALLY, it gives us the platform at a national level to come together and address the HIV/AIDS epidemic.
All our national organizations that have the respect of the community for years, our role has to be to frame the message that this is an important issue.
This collaboration in particular provides these organizations with a critical and uniform messages about HIV and AIDS.
It is up to the African American and the Latino community to take charge of this issue.
We are urging all organizations to see this as their role, that they should be holding seminars, they should be using their newsletters, they should be blogging, they should be participating in forums, talking about this in every venue that we have, because we all have a stake in this.
Together, we are acting against AIDS.
And I look forward to talking more about that, our initiative. After this event, we also have a reception, and a lot of our Act Against AIDS leadership partners are here, and and we'll get to meet them. So next to the stage is Dr. Thomas. Just to let you know again, Dr. Thomas is going to do a presentation, and after that, we're going to. What's wrong?
No.
Oh, okay. And then we're going to do then we're going to get into some really good questions with our panelists, and then we're going to go right to the audience and have the dialogue. We know that there are a lot of experts in the room, so we're going to really get into it. Dr. Thomas is a professor of Health and Services Administration in the School of Public Health and the director of the University of Maryland Center for Health Equity at the University of Maryland, College Park. Go Terps.
Fear the turtle.
Fear the turtle. Yes, fear the turtle. I am a Terp.
Fear the turtle.
One of the nation's leading scholars in the effort to eliminate racial and ethnic health disparities, Dr. Thomas has applied his expertise to address a variety of health conditions from which minorities generally face far poorer outcomes, including cardiovascular disease, diabetes, obesity, and HIV/AIDS. Please welcome Dr. Thomas.
Good evening. Well, I'm here to set the stage for what I hope will be a robust discussion, but I have to do some self-disclosure because I woke up one morning and watched the news. I watch the news all the time, and I discovered that I was a moocher. I was part of the 47, I thought about my family, the sacrifices that we've made to get where we are today. I walked in this convention hall, I saw all these black people, all these moochers. But what disturbed me was that it affected me. Why should it affect me? What other people could have someone who looks like them in the White House and let a comment at a conference room about the size of this, but you'd all be millionaires, call another group of people moochers, and it would affect them. So I realized that no matter what, we're still black, am I right? I don't care how many degrees you have behind your name, who's in the what, you are still black. And part of our challenge is to remember that. Not forget that we're black. And when we do that, you know what we can do? We can go back to how we got here. And that's what I'm going to do in the few moments that I have. I'm going to take you back to how we got here. Now, I'm going to say some things you may disagree with, but that's all right. Because we cannot agree on everything. These are complicated issues, but we do need the conversation. So here's my email address, contact information, so we can continue the conversation. And I took all the epidemiology out of my slides because if the numbers that you've just heard today were sufficient to get us to act and solve the problem, we would have done it a long time ago. So it's not about the numbers, but it is about, I believe, the social context. And it's in that social context and framed as a civil rights issue, again, that got us here today, that the ultimate aim is to uncover the social, cultural, and environmental factors beyond the biomedical model and address a broad range of issues. And this approach includes, but is not limited to, breaking the cycle of poverty, increasing access to quality health care, eliminating environmental hazards in homes and neighborhoods, and implementing effective prevention programs that are actually tailored to the community in need. And we must recognize that we bear the burdens of race and history. That's why the butcher thing got to me. I'm carrying the burdens of race and history. You don't have to go far back in my lineage. I had a grandmother who had to count how many marbles are in the jar in order to vote. We don't have to go back that far before we see the chains of slavery. So we've made great progress, am I right? But we got a long way to go. But because of these historic inequalities and racism in the healthcare system, many African Americans may delay seeking health care. Their beliefs about health and illness are influenced by the community, and their response to community health messages are shaped by these burdens of race and history. Why is it that our people, our community, seems to be the last one to get the message about how to stop the spread of AIDS? Now, if we put those epidemiology charts up here, we'd find that for white folks, their death rate from AIDS is going like this, a steep curve down over time from 1985 to the present. But for black people, our curve is still going up, 2012. And so I submit to you it's time to go back to basics. And I'm going to say that we go all the way back to the time of Booker T. Washington, when he too faced the challenge of black people dying prematurely from other kinds of infectious diseases, but nonetheless dying from preventable diseases. From 1915 to 1951, it was called the Negro Health Movement, the longest sustained public health campaign in the history of the United States. And Booker T viewed the poor health status of blacks as an obstacle to their economic progress. By the time they got ready to start a business after they got out of slavery, they were dying prematurely from preventable illness and death. This was before the germ theory. White people believed that blacks had different diseases, that we were a different species. But we were also cooking their food, raising their children, in their homes. And it took them time to realize that you can't let a whole population live in squalor and then come into your house and fix your food. You follow me? But before they got the message, Booker T said, you know what? We're going to do it ourselves. And he mobilized what became known as the Negro Health Improvement Week with this statement: where there is no vision, the people perish. So the origins of the National Negro Health Movement began with Booker T. Washington in Tuskegee, Alabama, where he said that 45% of all deaths among Negroes are preventable, that there were 450,000 Negroes seriously ill all the time, the annual cost of $75 million. Sickness and death cost Negroes annually $100 million. Thomas Levis and his group out of Johns Hopkins just put a price tag on health disparities in the billions of dollars. So we have been here before making this analysis. But we got to do something with that information. And Booker T said that because of these facts, I have thought it advisable to ask the Negro people of the whole country to join in a movement which shall be known as the Health Improvement Week, beginning April 11th to April 17th, starting in 1915. Now here's a shame that so many of us don't know about this movement, that it is not even taught in our schools and in our universities. This is the example of our contribution to modern medicine and public health, and it is a secret. By means of these organizations and agencies, all the colored people will be reached and influenced. They can be taught to do what to do to aid in improving their health conditions. And so he built a leg grassroots movement, including increasing the membership in the National Medical Association and documenting disparities. And he had a philosophical orientation. A given community is either healthy, a community with adequate facilities for prevention and care, or it needs to face its lacks and work out plans for necessary social, economic, and physical change to meet those problems. We have to do this ourselves. And so I'm going to go to the finish line here and give you what Booker T came up with and how it was so successful. You know why it was successful? It was simple. It was organized like a black church reunion, like a revival. It started on Sunday with health sermons, health talks, churches, popular mass meetings, speakers, and music. It was like a revival, and everybody, regardless of their level of education, understood it because they had all grown up in the church. They knew what a week-long revival was all about. On Monday was Health Improvement Day, Home Improvement Day, home cleanup, parent meetings, consider proper sex education. On Tuesday was Community Sanitation Day. Water, food, milk supply, waste disposal, clean streets, paving, safe wells, sanitary privies. He's looking at what? The social determinants of health at the time, causing black people to die prematurely. On Wednesday was a special campaign day. Survey of community needs. He was doing survey research work. Concentration on practical objectives. Conferences at noontime. On Thursday was Adult Health Day, emphasizing annual health examinations, opportunities for interacting with health professionals, and health talks to men and women's organizations. On Friday, School Health Safety Day. Involved the parents, health essays, health exams, school checkups, health clubs. On Saturday, General Cleanup Day, cooperative large-scale cleanup activities, inspection of community campaign results, completion of finished activities, collection of data and pictures and reports in newspapers. On Sunday, close the campaign with a meeting, talks, music, and experience. That was the plan. It was so successful in the South that by the 1930s, the U.S. Public Health Service took it over and brought it inside the federal government and called it the Office of Negro Health Works. The Office of Negro Health Works. By 1951, in the name of what? Integration. President Eisenhower said, what is this Office of Negro Health Works over here? We should be one nation, one people. Let's close that down and just have one big happy health and welfare office. And the Office of Negro Health Works came to an end. In 1985, when Secretary Margaret Heckler released her report on black and minority health, and we created the Office of Minority Health, it was like we had amnesia, like we're starting all over again. And nobody really remembered the breadcrumbs that were laid by Booker T. Washington. And so I'm going to submit to you that as you look at these evaluation objectives here, that they left documentation in libraries in your communities and counties around this country are the documentation of the Negro Health Movement, gathering dust. We should blow that dust off. We should recognize that the same core principles that Booker T used to mobilize our communities is exactly what's needed today. And to apply it to the issue of HIV/AIDS and the issue of racial and ethnic health disparities, and recognize that the only way we're going to get to freedom is if we do it ourselves. Thank you very much.
Good afternoon. My name is Deborah Catching-Smith, and I serve as one of the co-chairs for the Act Against AIDS Leadership Initiative with Mr. Michael Henson, who you heard earlier, and Mr. Tony Wayford. It is my distinguished honor and privilege to introduce to you our panelists for today. First, we have Mr. A. Tony Young, Miss A. Tony Young, so sorry, founder and executive director of Community Health Group, Education Group.
All right.
Okay. We also have Dr. Stephen Thomas, who you heard earlier, professor, Department of Health Services Administration and Director, University Maryland Center for Health Equity. We have Reverend Tony Lee, Senior Pastor, Community of Hope African Methodist Episcopal Church. We have Ms. Gina Brown, Southern Region Director, AIDS United. We have A. Cornelius Baker, Senior Communications Advisor and Project Director for FHI 360. And we have Ms. Rashida Abdul Kabir, Deputy Director, Circle of Care, and founder of BEBSHI Babashi. With us this afternoon, we have Mr. George Curry. Mr. Curry is a member of the National Newspaper Publishers Association Foundation. He is also a distinguished author, columnist. He co-owns Heart and Soul magazine, and he was the founder of, some of you may recall, Emerge magazine. And so it's my distinguished honor and privilege to present to you Mr. George Curry.
Thank you. Got a lot to cover in a little time. So these are the rules. We roughly have an hour. We're going to ask questions. I want short answers. I'm going to limit 30 minutes up here and 30 minutes out to the audience. We're not giving speeches. Let me first of all correct the title. It says, in search of black solution, what do we say about HIV and AIDS? Scratch out say, change it to do. All right, so we gotta limit ourselves in terms of our answers, so no long answers. I'll cut you off, y'all know me. When you look at these numbers, I want to start with you, Cornelius. When you look at these numbers, I mean, just let me pick out just a couple. When you just look at black women, for example, 64% of all cases diagnosed among women, 85% contracted through heterosexual relationship. Teenagers, 15% of the teen population, 70% of all AIDS diagnosed among teenagers, and you can go on, gay community across the board. What solutions, what can we do to make our community more aware of just the extent of this disaster and disease in our community?
Thanks, George, and certainly thanks to Lisa and other organizers for inviting me to be here. You know, we've got a big challenge up ahead of us, but as Stephen has already mentioned, our community, we've had challenges before, and we have survived them. And so I think that the first thing we do is look back on history, as Stephen has pointed to us to do, and look at how we successfully overcome burdens in the past. But I also think that we have some unique challenge, which the HIV epidemic. I was flying up from Atlanta this afternoon with Dr. Lewis Sullivan was on the flight, and we were talking about the work of his foundation now in doing health literacy work. To really address issues of diabetes, hypertension, and other illnesses that are affecting especially black communities. And you know, and it's really important work. What I would throw into that mix is that we have to have a very serious, honest conversation in our families and improve health literacy around sexuality. Now, we all got here through sex. Now, we can continue to make it a source of shame, of alienation from ourselves, from our communities, of our bodies, looking at women who have sex as, you know, all sorts of evil things, looking at gay people who have sex as just, you know, just these, you know, monsters, and demonizing black men's sexuality in general. Or we can go a different way that will help us address syphilis, gonorrhea, cervical cancer, HIV, all these other things that we're also at the top of the list of, and really demand real progressive sexual health education in our schools, but most importantly in our homes. And that because we don't have to wait for government to do for us, which is the process of sexual health education in our schools. Every mother can sit down with their child and begin a conversation, and one that respects their child and their sexuality, however it may come to be.
So Cornelius, you're saying that one suggestion is that we have these conversations you talked about, both in school and at home.
We have to demand it of our schools and of our political leaders that they don't allow our children to be ignorant.
Okay.
But most importantly, because we have often had to lead the way. We've led the way through social justice and through civil rights. So we're going to have to lead the conversation on sexuality. And we're going to have to teach our children how to use condoms. We're going to have to teach them what their bodies are. And we're going to have to really have a conversation so that people aren't ashamed.
Okay.
That will then help them get an HIV test and everything else they need.
All right, Reverend Tony Lee, how do we broaden this awareness?
Well, I think that there's a significant, and if I can just kind of connect to the statement my brother shared when he talks about how we have to have the conversation about sex and sexuality, I think it does need to happen in those places you just said, in the schools, in the home, but also in the church, because there's a need. And so there is a need to be able to discuss sex and sexuality in the church. And one of the challenges, well, there are a couple of pieces, but one is the church has to be able to really shape a language to enter into the conversation. And it can't just be a puritanical language, because the language the church has used historically has been to keep your zippers zipped and to keep your skirt down. And there's going to be a need to reshift, or the church to be able to enter into the conversation in a way, one, that connects theologically, but two, also connects generationally. Because what you also have to realize in the church, the challenge in the church is that most of the mainline churches, and most churches were born on the backs of boomers. That most of the churches right now have leadership by baby boomers, and baby boomers are very much about, especially black boomers, cultural appropriateness. And for them, it's inappropriate to talk about sex, sexuality within church. But you can't deal with generations X, Y, Z from a framework of what's appropriate and not appropriate, but my generation, the hip hop generation, is a keeping it real generation. And so you have to have a very frank conversation about sex and sexuality that takes place also in the church, and can destigmatize the whole concept of HIV and AIDS and testing and those kinds of pieces. And so I think that kind of conversation has to happen at the church level as well.
Okay, let me, Gina, I still want to answer my question. What do we do to raise awareness in our community? That was a question.
We talk about it. We talk about HIV. Those of us, because I am a woman openly living with HIV, who are positive have to stand up and say it. You know.
But is that safe? You know, there's always the downside of that too.
Yeah, there is a downside. I know y'all heard that 2 weeks ago today, a young lady in Dallas, Texas was murdered after disclosing her status. And instead of the man being on trial, HIV is on trial. And that's not fair. You know, we want people to tell their status. We want to get rid of the stigma. We want to talk about it. We want to bring awareness, but as you said, is it always safe? Right. I shared with my coworkers yesterday, I work at Age United, and I shared with them yesterday that I went on TV. That's how I told my status. I'm a dramatic person, I just went on TV.
That's dramatic.
What you gonna do? Now you know. Now you know it looks like you. Now you know it looks like your mother. Now you know it looks like your sister. And you can do something about it. You can have that conversation. And until we have a frank conversation in our community, and I'm not talking about just with the people in this room. Right. I'm talking about the people on Skid Row, the homeless people, the people in the crack house, that girl you see with that short skirt on walking the street at night. Till you have the conversation with them, it ain't going nowhere.
Okay. Rashida?
Well, you know, I've been doing this for 30 years.
Yes.
30 years. And this is exactly the same conversation I had the very first time I presented 30 years ago. I wish it was so simple as to say, always we'll put up some posters, we need to have a dialogue, we need to bring the churches in, we need to have people willing to disclose. We have had all of that, and here we sit talking about we have to do the church, and they need to change the dialogue. Honestly, I haven't a clue. I'll be honest, I don't know how do you impress people with the sickness that is overwhelming us, because we are not defining it ourselves. Other people are telling us how bad it is. So I don't know, you make it up, put up more billboards, and honestly, I really don't know. We have tried so many different ways, and still people in this room who do not consider themselves at risk for HIV because we're dialoguing about it, still aren't doing anything. It's y'all's fault. We're bad off because you. I don't know what else to say. You are, I'm telling you, this is our leadership. We are well educated. I just got a PhD. I'm well educated. But every day I ride the bus to go to work. I sit on the bus with people who are obese. Why? Because we are stressed out of our minds, trying to be white still. Until we are able to address that we hate ourselves and that we are never going to do any better than we currently are doing, we're not going to do this. We'll have another dialogue in another year, and I'll be saying I've been doing this for 32 years. Until we are willing to be honest about who we are and to really talk to one another. We don't talk, we dialogue. We don't talk to our young people. I am a, what'd you call me? A boomer, 50 boomer, something? I talk about sex all day long. All day long. People don't know about having sex. There's no reason why we can't have honest conversations, but we don't even know what an honest conversation honestly is. You know, no, you don't need to have sex. Put your dress down, zip your pants. Let's start with that. Because until we're willing to say stop, until you know what you're really getting yourself involved in, we can't do anything different about it. So yes, I do believe in honest conversations. I would like to say put some pamphlets and some magazines together. But 40% of our people still can't read. So what good does that do? That means that I have to talk to you face to face. Your film brought tears to my eyes the same way the 50 people that I buried over my first 10 years of doing HIV did. I bury people still every day who never heard of HIV, didn't think they were at risk. Why? Because we elite, middle, low-income black folks don't get HIV. So I'm saying, I don't know how to tell y'all how to do it. I do it by walking the streets and stopping people and saying, what are you doing? While your skirt is too short, you certainly are inviting some seriously dangerous behavior. That's how I do it. And they go, you know, that's that crazy Muslim woman.
Ms. Tony Young.
Well, thank you. You know,
I want to focus on what do we do to broaden the awareness in our community.
Well, I mean, the first thing we have to do is accept, you know, one of the things I wrote down is that we have to know where we've come from to understand where we are right now, right? And one of the things I feel like we have to do is accept that there has not been any continuity in the message, right? I don't think it's that we haven't had a message or we don't know the message. There's been no continuity in the message. At first it was, it's only a gay issue. Then it was, well, you know, it's a gay Haitian issue. Then it was, well, it's a gay Haitian injection drug user issue. Well, you know, maybe it's everybody too. And then it was like, well, no, maybe, and it kept changing and changing and changing. And one of the things that I feel like we don't want to do is accept that if we address HIV in the African American community, what we have to do is address the burden of the African American community: education, affordable housing, employment, teen pregnancy, food, clothes. I mean, it's real basic stuff. But it's real basic stuff that impacts the African American community that we don't have. So what we do, and I can only tell you what we do, is that we say, I can't wait for you to come into my door and ask me for an HIV test. I have to go out to you and give you an HIV test because you don't know what you don't know. Right? And I agree with you. There are a lot of people who don't know that African Americans, heterosexual African Americans, are at risk for this disease. The ones that are hanging on the block, the ones with the short skirt, that's somebody else. That's somebody else. They knew a girl that was hot once, but not them. But not them. I knew a girl once down the block, and nobody messed with her no more.
And she was like that.
Yeah, she was like that. But she's not.
But how do we deal with it? But how do we deal with it? We know
because you deal with it. You deal with it by accepting the fact that the reality of the situation is, and I think the good Reverend said it. We are a nation that is built on a foundation of Puritan principles, but those Puritan principles no longer apply. And the reality of who we are is that we have to go out into the street. And the reality of who we are is that, you know, and I always come back to this, is that the reality of the down low is this. This is the down low. The down low is when black people who are middle class, you know, and I would say a GS-14 to a GS-10 to GS-9, don't really admit to the fact that they have sex with people they don't really know, and that they have that sex in an unprotected way. That's what's really on the down low. It's how we have sex, who we have sex with, and how we have unprotected sex. That's the real truth, all right? So I think that what we do is that we start telling ourselves the frank truth about the fact that this disease has run amok in our community, that this disease has run amok amongst our children, that this disease has run amok amongst heterosexual African American women and heterosexual African American men. if you look at the numbers of African American women living with HIV in the United States of America, they are not worms. They are not having sex with themselves. Right. The vast majority are having sex with heterosexual African American men. And Cornelius, don't jump on me about the number of black MSMs. I'm there, I'm with you. But I think one of the groups we leave out of this dialogue a lot is heterosexual African American men.
Let me follow up on that.
And
let
George,
me follow. You'll get your time. Don't worry. Okay. But let me follow up on that. So how do we change that? I heard these speeches. Y'all sound good, but I want some answers. How do we deal with it? What do we do?
I mean, I think one of the things that we do is that I don't dismiss or distort the rates of infection amongst black MSMs in this country. I don't. But I say that I've got to get everybody involved in this conversation.
Broaden the conversation.
Yeah, we've got. I mean, not just broaden the conversation, but broaden the soldiers. Because see, this is. One of the things we keep changing is that we no longer say this is a war against AIDS, a fight against AIDS. We say we're going to do some prevention. This is a battle for our lives. This is a battle for our communities. The Affordable Care Act gives us a chance to talk about other health disparities, and the expansion of what we can do under it maybe gives us an opportunity to put HIV in a portfolio of disease.
Okay. Right.
But the reality is that we've got to get everybody involved in this war.
Okay.
Sorry.
I'm going to get you involved, Cornelius, and y'all got to cut these answers a little shorter.
And I totally agree. I mean, and so what I think, though, is that we have to get beyond false dynamics. I mean, in the black community, it's all of us. I mean, we share common neighborhoods. We basically share common churches, common community, everything. And so, you know, I just think that, you know, even that framework, Tony, while I totally respect it, it can feel for many gay men very marginalizing. So, I mean, we have several dynamics that are common in all of our communities, and we have to be very clear about it, because Rashida is right, that sexual health doesn't mean you just get to have sex. Sexual health means you know what you're doing,
You have a responsibility.
including the ability to say no. But this is what's happening that we're not talking about. If you look at a lot of the epidemic in our community, and you look at the sexuality that's being formed that is contributing to the epidemic in both young gay boys and in young women, it begins with sexual violence at a very young age. And we need to talk about why that's happening. That's part of sexual health. Young boys and young girls should not be having sex at 13 and 14 years old, by my view. But they should be respected and valued. Okay. Young gay boys, when they start experimenting at 14 and 15 years old, should not be thrown out of a black household. Because where do you think they go? And when you talk about homelessness that's contributing, those are the homeless. Those young boys who've been thrown out of our houses. That is not a black value. And we need to start challenging people who say, oh, I threw that child out of my house. Now you are sitting there with a friend who threw their 14-year-old out on the streets. That child is going looking for money and a bed.
Okay, let me stop you there because y'all really cut into my time. I want to shift it to testing. Again, I want answers, I don't want speeches. What suggestions do you have to increase testing? Because we know the sooner you get to test it and find out, you better chance you got of living a longer life. What do we do? I want examples and want you to be specific. Anybody? Go right ahead.
I mean, I can say right here in the District of Columbia, last year, my organization, Community Education Group, did more than 10,000 HIV tests east of the river. Right? That number is great, so it's not just about testing. The real number is like really looking at what the positivity rate is amongst that group, and so our positivity rate hovered around roughly 2.6%, 2.7%. I'm looking at my testing director at the back, so because I jack a number up, and you know, but our real number that I'm proudest of is that we have a 96% linkage to care, retention in care, and make sure that an individual is not lost to follow-up number. So you know, you can test to the...
How do you do that? Because I think that would be instructive.
See some of those people standing back there on the back row. They go out starting at 11 o'clock in the morning. They usually come back really grumpy around 5 o'clock. And so they go testing in some of the communities that you probably wouldn't want to. You probably wouldn't want to leave your car in. But, you know, it's literally almost going door to door. You know, and so we really, and it's before anybody says it, we've looked at the numbers, we've pulled them apart. This is not a huge number of repeat testers. It's less than, actually much less than 1% of these folks are repeat testers, meaning they test more than 3 times or 4 times in a year. So, I mean, that's what it is, and that's what I keep saying. It's really about going back to the basics and boots on the ground.
Dr. Thomas. Y'all gonna have about 5 minutes. And all this
well, I just say we need to go back to Booker T. He was about business. HIV/AIDS is $1 billion business. Why don't we have any companies? You know, why don't we have any multi-million-dollar company? Why don't we have a multi-million-dollar fundraiser? I go to the grocery store. I'm doing a check. Do you want to give something for so-and-so? That used to be Coleman Race for the Cure, but now they ask you, do you want to do it for pets and dogs and cats? My point is, the infrastructure that has around HIV/AIDS as an enterprise has built capacity within the white community. Why isn't that capacity not in our community? So my point is simply, George, let's put another hat on too. Where's our testing companies? Where's our entrepreneurs that can produce home test kits, et cetera, et cetera? We need the whole range of activities, number one, and number two, we got to get rid of the stigma. Right here in the great state of Maryland, we have Delegate Shirley Nathan Pulliam in the back room there, a champion for health disparities. We have Baltimore Ravens, the macho of the macho, stepping out and addressing the issue of gay men. And what has been the response to some of the delegates? Phone calls slamming them. We've got to get rid of the shame. The only way you get rid of the shame is to lance it, let it all out. We got to have an open room like this and begin to talk about that shame. That shame is keeping people from being tested, from telling their partners, from talking healthy about issues of sex. We're going to get there, but I just simply think we have to accelerate it. We cannot have the luxury of taking our own time.
Tony Young, what are you doing in the churches to expand testing?
Me? Or him?
That's Tony Young. This is Tony Lee.
The Mr. one.
Well, and actually, I want to celebrate Tony Young, the Community Education Group, because they have been a great partner for us at Community of Hope, where I pastor. And so one of the things we've been doing is that we do testing during church service. And so we've been able to shape...
Stop right there. Don't go too fast. During church service.
During church service.
How often?
Quarterly. And so we do quarterly testing during church service, average testing about...
You can give the blood.
Average testing about 130, 150 people each quarter during church service. And what happens is I get tested, leadership gets I get tested in front of congregation, middle of service, and then they're able to go get tested while service is still going, still be able to come back for the sermon. The reason we did it is because within the church we had to shape a theological framework. And what we dealt with was the whole concept of your body being a living sacrifice, but also your body being the temple of God. And so we see testing as a reasonable act of worship. And so worship service is not just about shouting, but it's about taking care of yourself. And we even have a catchphrase that God loves you, love yourself enough to take care of yourself.
That's powerful.
And that kind of piece. But it can't just be in the church. Well, a couple pieces. One, at the church...
Before you do that, now, what kind of linkage do you have for treatment?
Well, what we have is the Community Education Group does our testing.
Okay.
And so, see,
you're already linked to...
So we're already linked to everything they're linked to. Before that, we did...
We don't go too fast, but I really understand what you're saying. You do the testing during the service.
During service.
But you let a group know what they're talking about.
Right.
And can find help for people who need.
Exactly. Exactly. The other piece, though, and one thing we're doing, say with the community education group, is we have a club tour, and so on next Friday we've partnered in the DC area with the go-go clubs, the go-go community, and the clubs. And so next Friday, Community of Hope is hosting Junkyard Band at Marigolds, and if you get JY, that sounds like somebody from Southeast. I'm talking about.
Now tell us a little more about that.
And so we partnered with the club owners. We've done it at the Legend nightclub. We're doing it at Marigolds. We did the Legend with Backyard Band. We're doing it now at Marigolds with the Junkyard Band. Whoever gets tested gets in free.
Okay.
And so it's all out in the community. If you get tested, then you get into the club for free. And it's a church coming together with an organization that has the capacity to handle whatever comes out that way, that knows what they're doing, but we're utilizing and bringing together unconventional partners also with the go-go band. So you got Bugs from Junkyard. So Junkyard will let me get on the mic while they're playing and talk to the crowd. Well, the band stamps us. That makes us legitimate. Then we're pushing folks to the testing and anybody. And so it's that whole kind of range. But we need to pull together everybody. You said all boots on the ground. Everybody coming together, utilizing all that we have to make sure that we get the work done.
Now this is the kind of discussion I hope for. And it really is, because we're learning some different approaches, not just long speeches, somebody actually doing something and telling us exactly how they're doing. I appreciate that. Any other ideas, any other novel, different ways, effective ways are you expanding testing? Anybody else on the panel?
Well, we do it door to door, literally. We pick. Oh, I'm sorry. My staff does literally ring the doorbell. We outreach in the community for a certain number of days, flyers, ringing doorbells, and we bring a mobile van right to the neighborhood where people, you already know me because I've been knocking on your door for 3 days, tell you on Thursday we're all going to be there. You come in, you can get gift certificates to Rite Aid or whatever the latest drugstore thing is. We give meal cards. Food is amazing thing because our people are hungry, and a $5 McDonald's card will bring people in to get tested for HIV. So we do use incentives to get people to come in. Once the neighborhood is familiar with you and they see you, they recognize who your people are, then they start to send other people.
Wow.
So that does work, but that is a very intensive type of outreach. What you're talking about, you do with the church, that's very intensive. That's a commitment of resources. We don't always have them. We make stuff up. I will tell you. But it is a very intense way to do it. But that's just about the only way that we're going to be able to get at people where they are, is literally ringing the doorbell.
And do you find the same people help you in terms of the McDonald's or coupons or the same businesses?
Oh, sure. I mean, there's a group of them, like I say, the drugstores and McDonald's. Burger King hasn't done this part yet, but we're pressing them on it. But, yes, they will help out, because you have to appeal to their, corporate sense of involvement in the community, whatever that gland head business is, that you have to do. But yes, that is very beneficial to us. We have our football teams, and they come and do days where it's the Eagles Day, and they'll do that. That also is important because people look up to those players as significant role models and that sort of thing. We have to talk to them about their role model behaviors in advance of that, because you can't say you're a role model for appropriate sexual behavior but you have groupies all over the country. It's a little contradictory, but certainly utilizing whatever their messages are to get people in. Again, incentives, you get a t-shirt or a helmet or some sticker or whatever, but those things become really important. So any of those kinds of activities and partnerships are really important. We actually don't expect that every pastor is going to become an HIV educator. But we do expect every pastor to know who the HIV educators are in their community. And so we have to be willing to have those dialogues. And I think the clubs are a really great idea. We've done a few things like that, but we mostly take the van out. Getting the van was a challenge, but we managed to figure out a way to pay for it and keep the gas going. We have fish fries for gas money now. But, you know, being able to get into the community with that kind of vehicle becomes really important. And we don't limit ourselves only to HIV education, because while you're there, we have to talk to you about and make sure you look at McDonald's menu, get the low calorie, low fat, all of that, you know, kind of information we try to share.
Wonderful, wonderful. Let's give our panel a hand. I mean, this is great. Okay, now it's your turn. Not your turn to give a speech, to give a sermon. Remember what we're talking about, solutions. Lisa, take them away. Over here, got a hand of George.
Hi, my name is Dwayne Lawson Brown, Metro TNAs, located here in DC, and I had a question for you. So I work with youth.
Excuse me, those who have questions, just get on the line on the wall over there, okay, and we can keep going. That'd be the easy way of doing it. Thank you.
I work with youth, specifically 13 to 24. I was wondering, what age do you think is the age to start the conversations within the home, within schools, and within the church? Personally, I got my first HIV 101 sort of session when I was in school in 4th grade. And I was wondering, what age do you think is appropriate, or do we need to really be in there? Like, what age should we start?
Not just the age, let me amend that. Not just the age, but your approach in doing that. Go ahead.
Right.
Can I answer that?
Go ahead.
I have a daughter that's 17. I was pregnant with her when I was diagnosed. When she was 3, I taught her good touch, bad touch. You make it age appropriate. When she was 7, she saw me taking my meds, and she said, "Why do you take all those pills? And don't lie." And when she said that, I knew I had to tell her the truth.
Wow.
So I explained to her what HIV was, and I explained to her that I was pregnant with her, but I took a medicine. She didn't have it, I did. She was okay with that, but I kept the conversation going with her. She'll tell you now at 17, and I'm proud to say my daughter is still a virgin. She'll be 18 in November, because I never made sex a mystery in my house. We always talk about it, you know, and we talk about everything. Sometimes I think I embarrass her because I talk about it a little too much.
I also agree, Young. My boys all grew up through this AIDS epidemic. All of my boys grew up, Michael too, all up through this age, and honest dialogue as soon as they are cognizant. So at the very least by 7, because they can understand. And in this day and age, with all of the technology, we have all kind of blinking things up here. You know what I mean, that connect us. So they're already so far advanced, so aware of what's going on. As soon as they're cognitive, if I can teach you right and wrong and how to go to the bathroom, and you ask me for a cookie, I'm about to tell you something.
All right. Thank you. Next.
No cookies at my house. I'm gonna give you a lecture.
Hi, my name is Monty Alves, and I'm with The Watchful Eye. I don't really have a question, but more of a comment. You know, I've been doing this work for 15 years now, a little over 15 years. And the truth is, I really don't think there are any questions that any of us in this room should have about HIV and AIDS if we're doing this work on a daily basis. I've done all the programs that were talked about up on the stage.
What's your point then?
I've done all the programs that were done up on the stage, you know, and they all work. The issue is that they all rely on funding, but one thing that doesn't rely on funding is a conversation. You know, our President Barack Obama says that we're all agents of change. But if we're not wearing the AIDS ribbon, we're moving around like secret agents. No one knows what we represent, what we're here for. Here we are at the USCA, and we do this every year, every 2 years or so. But, you know, if you're not wearing a ribbon, people aren't going to ask you questions about what's that ribbon about. If this were a conference on, you know, breast cancer.
Let me follow that. So you saying wearing that ribbon there starts a conversation.
It's about conversation.
Okay.
It's about conversation.
Okay, that's a good point.
Programs.
All right, thank you.
I wear a bracelet.
You wear a bracelet?
That women are living with HIV made to raise money for their organization to do more AIDS awareness.
All right, so that's a conversation starter.
I think so, when they start reading it.
All right, now let's end your conversation, go to the next person. That's right, hold the microphone, take it away.
Okay, Vanessa Dixon, DC Healthcare Coalition. Can you hear me?
Loud.
Okay, curriculum, just a specific recommendation.
Great.
I used to be a Sunday school teacher at a church. Granted, it was a Unitarian church, which is not your average black church.
That's true.
But they had a sexuality curriculum. It was called About Your Sexuality. And it was very interesting. So there were 13, 14-year-olds. We did a survey. It's probably about 10 components to that. And we did a survey to see what was most important to them. Lovemaking, masturbation, sexual images in the media, homosexuality, and probably by 2 to 1, homosexuality was at the top of the survey that we did. So we started there. We started with what they wanted to hear, and then we went down through the list. So that's one suggestion. For the children
Stop, hold on. I want you to go past that. Sexuality curriculum.
Right. About Your Sexuality is the name of the curriculum.
Now tell us a little more about it.
Okay, well, it's offered through, at the time I was going to All Souls Unitarian Church, so it's a Unitarian Universalist curriculum. This was many years ago, but I presume if anybody's interested, they could contact the Unitarian Universalist Association or All Souls Church to get more information about that curriculum, about your sexuality.
Okay, now you're going to your second point.
Okay. And so then as part of that curriculum, there was a movie out at the time called Just Another Girl on the IRT. Very good movie. We took the young people to see it, and it was about choices. It's all about choices, knowing if you do A, then this B could be the consequence. So measure carefully, weigh carefully, know that there is a consequence to your actions. So that's for the kids who go to church. So the kids who don't go to church, the young people who don't go to church. I have a friend who works in an STD clinic, and she sees these kids so scarred up from so many sexual activities, so many genital warts that they think, hey doc, give me a pill, what can you do, give me a shot, make it go away. And it's like, I can't make that go away. So what to do with these young people, I don't know.
Okay. Thank you. We have specific suggestions. That's what we're trying to do, get solutions, not speeches, solutions. Oh, she's going to hold the mic because I told her to take them away if somebody gets long-winded.
It's cool.
Control the mic, control the conversation. Go ahead.
I got two thoughts. One, I just came from a meeting at CDC a week ago to talk about.
Can you introduce yourself?
Yes, sir. I'm Warren Hewitt.
From?
Warren Hewitt.
I'm from Samson. Go ahead, make your point.
I just came from a meeting at CDC to talk about what do we do with the CBO in the aftermath of the Affordable Care Act. And the bottom line is that we all agree that we got to have a strategy, because every time we fund programs, we change the landscape of the funding pattern and therefore the service pattern. So part of the discussion about strategy and implementation has to do with institutions like mine, SAMHSA, Substance Abuse and Mental Health Services Administration, CDC, Centers for Disease Control, HRSA. We have to talk about how those institutions embrace our ideas, our feelings, and our strategic points of view about how we address HIV in the African American community. If you look around, and I've been around in this area as long as Rashida has. By the way, Rashida was handing out condoms with her mother at the Hilton Hotel during the Black Caucus years ago.
Absolutely.
Anyhow,
probably to go back, but go ahead.
If you look at the layout at CDC or HRSA over time, you will see it's gone from being a virtually a lily white, non-sexually oriented group of folks to a group of folks that have a very good understanding of sexuality and men who have sex with men, but there are very few African American males or females who are interspersed in these organizations who reflect the ideas and the persona of the African American.
Let me ask you a question. How do we leverage it? You said we need to have influence with these agents. How do we do that? What do you recommend?
We have to speak up.
Where? I mean, we're speaking now. I mean, where? How do you be effective?
You got the Congressional Black Caucus here. Congressional Black Caucus has there's a GAO report that's been authorized to look at the Minority AIDS Initiative. So we need to talk about how that initiative has worked or not worked for the best interest of the African American community.
Okay, thank you.
Okay.
So George, could we also just go further with what Warren said, because this is the intersection that was talked about earlier.
Okay, go ahead.
That we have to speak up. We have to utilize the Congressional Black Caucus, and we have to vote on this issue. And it's not voting on HIV purely. When you have the state of Texas trying to defund Planned Parenthood, which is basically defunding reproductive and sexual health for poor people. When you have Congress stopping the District of Columbia from spending its own money for reproductive health, abortion services, any of that, that has to be part of our political agenda. So we can't be in a position where we complain about the gay community, which was dying. making HIV part of a political agenda and getting funding and responding and benefiting and using the drugs, and then not use the example. And so, so when we then vote, it has to be more than just this vague sense of what is social justice. Our health has to be part of the social justice. And we have to let politicians know that when we reject them, when we vote against them, when we organize against them, that's why. When Senator Atkins says something like, a woman can just, her whole body will just shut that thing down if she's raped. We have to let them know. I mean, all these black women in the room, do you all have magical powers? So part of the solution is voting.
Okay, I'm going to ask everybody to hold this moment because I got people, y'all had to turn. Okay. We're going to get to you, work you in, but I got to deal with the audience.
Yes, hi.
Yeah.
I'm Dr. Marilyn Corder, adolescent specialist. But my concern, we haven't said anything yet. I'm on the National Medical Association board, NMA, and I'm also on the SCL board, as well as I do radio on HUR Radio 1.
So give us some ideas. So you've been everywhere. So give me some suggestions.
Here we go. You all haven't addressed why doctors don't see it as important as a basic panel of labs. I'm a physician. I see teenagers. As soon as you have a genitalia that's in puberty, you get an HIV test. I don't even ask you. It's part of it. I tell them you have genitalia, that's a weapon of mass destruction. And you need to know that even, I don't care how many stacks of Bibles, it's part of my routine.
Okay.
HIV, I mean, my staff is here, everybody gets it. Now, unfortunately, we do see more than 2% because, you know, they're not talking about it at home. They're not talking about it in school. And we see it, and we still see that unprotected sexual activity. So we come and we bring it together. And I'm always talking. I do talks of is sex worth dying for. I do talks everywhere. So I think that we need to do it. And the physicians, the medical community has to step up.
Gotcha.
We're talking about the church. We're talking about the community. The physicians are failing us.
Gotcha. Good point.
And I'm a physician of 30 years. Your physicians, if they don't say, you know what happens? If you're middle-aged, and you know, GS 14, 15, or if you're even a physician, and you go to the doctor's office, you have vague symptoms, flu-like symptoms, they should do a test. Routine test, they should do a test. One of the hospitals
I got your point. I got to roll. I'm sorry. I got to roll. At least pull the microphone back. I got to go.
One of the only hospitals that does HIV right there in the ER, and we picking up positives that say those patients seen 3 or 4 doctors for vague symptoms.
Gotcha.
So you got to do it. Testing.
At least pull the mic back. We heard you. Okay. Let's go. I got people lined up. I'm not even going to the panel on that one. Go ahead. Keep it short and keep it specific.
Hello, everybody. I'm Stephen Edmonds, and I'm here with the Black Men's Exchange National. And one of the things that we've done in the Black Men's Exchange is that we have a course here called Critical Thinking and Cultural Affirmation. And what that is basically we're going way back to our
Now tell me, what are you trying to do specifically? Okay, what are you doing? You should get this course for whom?
For our course is for same-gender loving black men, you know, gay men for people who don't know that, but we, same-gender loving.
I think everybody here kind of know that. They got that.
Okay. Well, what that is that we basically teach people of African descent, where they come from, why is it that they're doing it, the things that they're doing, the negative stuff that they're doing, and how to break out of those patterns.
So how do you reach them? I mean, how do you get in touch with them?
Well, right now what we do, we have weekly, and here in D.C., Washington, D.C., we have them all over the country, but here in specifically Washington, D.C., we have weekly meetings, and we have weekly forums, and we talk about different issues affecting us as same-gender loving and also African Americans.
Gotcha. Next. Got to roll. Got to roll.
Okay. All right. Hi, I'm Valerie Rochester with the Black Women's Health Imperative here in Washington, one of the ally partners. And one of the things, Cornelius kind of touched on this a little bit.
All right, hold on, can't hear.
One of the things that we work for is ensuring that the reproductive justice and rights of women are protected. And we cannot sit back now that we have the Affordable Care Act and rest on our laurels and think we're all going to be okay. I thought I had the right to do with my own body what I choose to do, but there are those out there that are trying to say, I can't get contraception still, I can't get reproductive health services, and all those things. So the groups that are trying to dismantle the Affordable Care Act are those groups that we have to be aware of and make sure do not succeed in this, because all of this impacts HIV further down the line. We have to be able to control what happens with our own bodies, regardless of what the legislation says.
Gotcha, thank you.
And Black Men Exchange is also an ally partner, since he didn't mention it.
Good afternoon. My name is Linda Scruggs. I'm a woman diagnosed with the AIDS virus. I'm here with the All-Term Institute, but I'm making a Linda Scruggs statement. Have worked in this field for 20 years of my 22 years of diagnosis, and have unfortunately but fortunately worked with thousands of women across the country and the Caribbean. And what I've been saying this for a while, so some folks who know me, they're already nodding their head, and Tony Young alluded to it. Until we, women-formed organizations, our funders, begin to educate and implement the intersection of Black women and heterosexual Black male education around HIV, we will continue to have this problem. We can educate, we can empower women, we know it. Women still go home and say, yes, baby. With all the information, we've spent millions, billions of dollars educating, empowering Black women on this epidemic, but they still go home, and we, from PhDs to no CCs, and say, yes, baby. And we compromise our education because those men have not been in the courses, they have not been in the rooms with us, they are not invited, and they're compromised sometimes by their parents of MSMs being in a place where they supposed to learn. They need a separate place, and there are many women organizations who need to open their doors to the partners of those women, and they're having relationship with men who identify to be heterosexual.
Let me ask you a question. Good point. Let me ask you a question. How do you tell the woman who's saying yes, baby?
We've taught her how to say.
Right, hold on. Let me ask a question first.
Okay.
How do you before they say yes, baby? How do you teach them how to negotiate?
We spend millions of dollars of teaching negotiation. We teach them.
What do you say to them? I want to know.
What do we tell them? Okay. I'll get a whole minute. Okay. I didn't want you to go there with me.
I want to go there. We're looking for solutions.
I didn't want to go there.
We're looking for solutions.
I think we teach women the importance of their body. We address the fact that many Black women who get an HIV test positive, before HIV positive, they had trauma. They had trauma from sexual rape, they've had trauma from molestation, they've had trauma from being told they're ugly or too fluffy all their life. So above getting through all those traumas, talking about how important, if I'm the ugliest thing in town and he looking at me, and I ain't had none, but I had that one time and I want to feel like that again, I say yes, baby. Regardless that Linda, Rashida, Gina, Kathy, anybody else have told me, I'm going to say yes, baby, because I want touch. As a human, as a woman, we are embedded by the touch of men.
So how do you address
it? Some of us not by men, but we're embedded by the touch of relationships.
So how do you deal with it? How do you address that?
How do we deal with it? Some of us have, without funding, had to implement programs that I can invite Harold, I can invite John, because Kathy is still going to let him touch her without that condom if it's nothing but one time.
Okay.
I always say a statement, I'm married, I love my husband, but I don't walk around with his penis in my pocket. I assume that it's at the Penn Station in Baltimore, but I might be wrong.
Okay. All right. Gotcha. Good standard. I got the point.
So I really think that there's a lot of women in this room. We have the place that we need to create a space for these Black men who want to be taught, who want the education, but there aren't venues for them. Thank you.
We're keeping it real today. Yeah, I did. I got it too. Yes, sir.
Okay, good day all. My name is Alfie Gill. I'm a retired professor of City University of New York. A few years ago, the World Health Organization brought out a report which showed that there was less HIV among circumcised males than among the uncircumcised. So I want to know, what are we doing to encourage, or do we think it is important that our males should be circumcised? And that will be another tool that Blacks can use in helping to fight this pandemic.
Okay, thank you for your question. These are going to be the last two on the wall already.
Well, you know, again, we continue to come up with medical interventions, and there is this relationship between being circumcised. But there is an organized group of people in the country opposed to routine circumcision. So we find our communities on sides of these issues sometimes, whether it's reproductive health issues, whether it's marriage equality issues. We find ourselves standing with the people who sometimes think that we're the moochers. Mm-hmm. And so these issues have become the wedge issues that have in many ways divided the black community, because we don't have more forums like this to talk about some of the tough issues.
Hold on, got a special question. I got an answer here.
Come on, Doc.
As a pediatrician, let me tell you what happened with the circumcision. 20 years ago on back, and 15 years ago, everyone was circumcised.
Right.
You know what stopped it? The money.
The what?
Money.
Insurance.
They didn't want to pay for it. So
Insurance.
what? The insurances. So it's like, oh, well, you really don't need it. And then it's like, well, that's trauma. But they just had a report from the American Academy of Pediatrics, and it said you do have increase with the World Health in terms of infections, including HIV, if you're uncircumcised. So for what now? They pay, I'm gonna tell you what they pay for circumcision, because my husband, who's also a pediatrician, he's still circumcised no matter what they do or don't pay. They pay $30.
Yep.
They used to pay $400. $30, right? But it's worth it. So, you know, I mean, I know it's a decision of the parents, but seeing what we see years later, that's something that you should make sure your insurance takes care of.
Okay, next.
Last
two questions. Two questions.
No charge.
You get space. Bob.
She did mention SCLC. Oh, SCLC is Allied Partner. Woo-hoo!
Hello, everyone. I'm Terrence Young from Community Education Group, but in addition to my role at Community Education Group, I'm also the co-chair of the Heterosexual Men of Color Coalition.
All right.
A lot of comments have been made about the need for heterosexual men to step up and be at the table and in the discussions around HIV prevention. I just want everyone to know that there is a coalition established that plans on doing just that. We definitely agree that heterosexual men have to be a part of the solution in the black community around HIV. And we also agree that we have more like concerns than unlike concerns with all populations around HIV. And we definitely want everyone to know in all the populations, in all the communities, that we aren't coming into this discussion in an adversarial way. We're coming into this discussion in a results-oriented way. We need to be together in addressing HIV in our community.
All right,
it's all of our issue.
Perfect. Thank you.
How can they get in touch with you?
hmocc.chair@gmail.com. hmocc.chair@gmail.com.
Okay.
Heterosexual Men of Color Coalition.
All right, next.
Thanks.
Hi, how's everybody? My name is Anthony White. I'm an alum of CBCF, and I work at Coppin. I just got here, so I'm a little late, but I don't know if it was discussed already, but this is maybe a solution or maybe some conversation that needs to be had.
We want solution.
Okay, right. All right. So sexuality, you know, is a real thing, right? So there's a lot of, you know, bisexual people in the world, right? And I think for women, you know, who are being affected by men who are undercover or engaging in sexual acts with men, that the reality is that if they have an open forum, meaning these men who might be interested in maybe stepping out. I know I'm kind of on the board because I know people are like, oh my God, he's saying this, right? But if they have an open forum to have a discussion with their girlfriends, wives, about, you know, I find him attractive, you know, because I think we walk down the street, people find each other, men and women.
Hold on, man, you did come late. Make a point. What suggestion do you have?
My point is, I'm long-winded too, right?
Okay, not today.
So
not today.
Right. I don't mind.
Not today.
So my point is,
I'm the wrong one.
If we're more comfortable about people's sexual orientation or people stepping out and maybe trying something, then there will be less HIV in our community because people are comfortable about talking about it. That's all.
Thank you. All right, Bobby Henry, your last one. You've been sitting down.
Can I hold the mic?
Yeah. No, please. Hell no, not him. Hell no.
Okay. Good evening, afternoon, everybody. My name is Bobby Henry. I'm the publisher of the West Side Gazette. That's Broward County's oldest and largest black-owned newspaper.
That's why I told you to let him hold the microphone.
I was involved in a panel discussion about 3 years ago here. My daughter is HIV positive. She's 42 years old, so she's been positive for about 27 years, and she's healthy and doing good. Now, my thing is, as it pertains to testing, one of the most strenuous days in my life was when I got tested, and I did it in the front of a group of publishers. Not just publishers, black publishers. So if there was anything that would have came up in my situation, any kind of way, shape, form, or fashion, it would have been all over the world. But because of the seriousness of that, I decided to do it. Whatever ramifications that would have come because of that, I decided to do it. Fortunately for me,
you ain't lying.
And all my extracurricular activities, it came up negative. Now, my question is, oh, y'all laughing, though it don't happen to y'all.
No, we were waiting for his test result. I will tell you that part.
My question is, how many of you on the panel, through your organizations, your associations, and all the things that you do, that you've thought enough about to put in your budget requests for advertising in black newspapers across this country so it could be known and stated that we, being the voice of black America, to achieve some of that money, Dr. Thomas, that has been given in the fight against AIDS and HIV? How many?
Well, just quickly, we made major investments with the New Pittsburgh Courier. In fact, they now have a whole health section that was initially funded by our work. We worked with Bev Smith, Urban Radio. She now has Health Wednesdays. Every Wednesday on Bev Smith's show is about health. That all began with investments that we made with our research dollars.
Okay.
So we have actually an ad in the CBC newspaper that's going around now. We have a partnership with the Washington Informer, and I'd actually like to say that one of the writers for Heart and Soul does most of our writing on a separate contract, not on your time.
Good.
But you know, so we have a very strong commitment to using black newspapers around the country because we do think they carry a unique message.
All right, let me do this because I'm going to wrap up. You know, we can't go to organizations and say we want to do things and we're not supporting them. Black media, not just black newspapers, radio, rest of them too. You know, that's the only place you're going to get the voice, you get the real story, because they don't wait till one time a year to write a story about it. That's just all our institutions that we have to support. Y'all got 1 minute, you're on the clock. One thing I believe is getting out of here on time, because this is not going to be one of those things where you start one day and it ends the next day. We're going to finish today on time. 1 minute, start on you, Canadian.
Great. Thanks, George.
No. One each.
This has been a good forum. And because I think that, you know, we know that there's a lot of the choir here, but being able to have these conversations together is important, and working together is important. I think, you know, there's been a collaborative between the National Black Gay Men's Advocacy Coalition, the National Black Women's HIV/AIDS Network, and now the Heterosexual Men's Working Group. That's really important because we do not have time to waste, and we certainly don't have time to waste fighting each other. And so I know that those three groups are deeply committed to that. I think the last thing that I want to say is that, you know, there is a lot of bad news that we can look at the numbers, but we should also remember that since 1996, when we developed more effective treatment, that the death rate has dropped in half. And that's an important story, that we need to get people in our community tested, because we know that there are solutions, that there are medications, that if you go to your doctor, that you can live a long, healthy life. And through the work at FHI 360, the HIV Prevention Trials Network, we just saw in study 052 that where people who are HIV positive are also on treatment, that we saw 96% drop in infections. So they are less infectious than to their partners. So we have solutions. The issue is, will we apply them?
The church needs your help. The church needs your help in being able to address HIV and AIDS and deal with the fact that it's not outreach, it's inreach. And that any given Sunday, there are people who are infected and affected by HIV and AIDS in our pews. And we need those who know what they're doing to collaborate and partner with churches to show them how to get connected. When you look at the numbers, it can be overwhelming. When you look at what the heck are we going to do? I wasn't trained in healthcare. I'm a daggone preacher. I know how to preach. And so when you look at that, sometimes it's overwhelming for pastors to look at how do we get connected on health issues. We need partners that can show us, but not just that, but we need partners also who have a level of capacity so that when we're bringing them in, it's not a whole nother major kind of piece. It's a recession. Churches are trying their best just to hold on and keep the roof over their head. We need partners that have the capacity to come in and be able to do the work so that we can kind of have partnerships to be able to move it forward. Bless you.
I guess what I want to say is when you think about HIV, don't think about it as far as risky and high-risk behavior. Just know if you have sex without a condom, you can become infected with HIV. HIV doesn't care what's between your legs, the color of your skin, or what's in your bank account. It's a disease of opportunity, and when we give it an opportunity, it comes on in. So we have to be mindful of that, and we have to have those conversations, those difficult conversations with our children, with our spouses, with our friends. A lot of times people don't talk about sex because they don't know how, but if you don't know how to talk about sex, call me, I will teach you.
And what's that number?
You'll pass your number out now. I just want to say that, you know, I have been doing this work for a very long time. And one of the things that I'm acutely aware of is that the solution, the black solution, is not one-dimensional. There's no, if you do the church, it's all gonna go away. If you take medication and so on, it's all of those things. So what I would challenge all of you to do is know who's doing the work in your community. Look on the internet, look at the pamphlets, look them up, partner with them, volunteer with them, write for them. There is something for all of us to do in this work. It is all of our responsibility to do it. And I will tell you that the critical piece now is getting young people involved. I keep asking everybody side to side, who are the chiefs of staff? Are the chiefs of staff in here? Good. So now we got one person out of all of our caucus. I'm gonna tell you, that's how important HIV is in the black community. We got one person who showed up for this forum. We have got to be involved. Those of you who are politically active, you find out why they didn't come here today. Because this is the issue that's killing us. We have to take responsibility for what's going on. And if we don't, nobody else is going to care. So get to work, y'all.
Hold on. Who's your congressperson? Who you work for? Chief of staff? Okay. He's not in the caucus, but go ahead. Go ahead.
You're on. Oh, she was waving her hand. I think in my last minute, I mean, no.
Will I miss? Hold on, time out. Will I miss?
I was saying I'm not the chief of staff, but I'm here representing the United States Senator Sherrod Brown.
Okay. Anyone else represent the congressional staff? That was short. Next.
Good thing they didn't give you a hook. I mean, this could really be bad. I think that in closing, I'd like to say that I think that where we are in this country with HIV, where we are with healthcare, is that it's all of our problem. It's all of our challenge. For us, organizationally, a community education group, I think that we have really decided that we want to stay in our lane. And staying in our lane means that we do health screening well, so we'll expand the health screenings that we do. We link folks to care well, so we'll link folks to care regardless of disease state, and we'll do that well. But, we're not a church. But so we'll work with a church. We're not a hospital, and so we'll work with hospitals. We're not an insurer, so we'll work with insurers. I think that, and it's also just very important to me to say it. So when we have a conversation about heterosexual men or heterosexual women, it's not an alienation or isolation of my black MSM brothers. It's not that, and I never want it to be framed that way, perceived that way, or heard that way. it is to say that this is all of our challenge. And that is why I certainly started my statement there with, we know that black MSM in this country bear the brunt of this epidemic. And I won't shy away from that, but nor will I shy away from the fact that this is all of our challenge, regardless of who we sleep with. And it's like I always say, you know, I live by the 50 paces rule. At 50 paces, you don't know if I'm gay or straight, necessarily male or female. But what you know is that I'm black. And so some judgments have been made. And I have to tell you that with the 50 paces rule, this is all our challenge. So, I mean, with that, I say, you know, again, we have to go boots on the ground, do what we do best, and not do it with fear, and not do it with shame, but do it.
You know, yeah, thank you, thank you. This has been an amazing forum. I began with Booker T. Washington, and I'm going to take you back there. We know how to do this, people. We're talking about $1 billion industry, and yet some of the leading organizations have to do fish fries to put gas in their vans. There's something wrong with that. So there's some lessons for us to learn from the Susan B. Komans of the world. I have the advantage of living in the great state of Maryland, where we have an Office of Minority Health and Health Disparities, where the director of that office is in this audience right now. Raise your hand, Dr. Hussein. Where we have passed a law. Give her a hand, will you? They fight every day for us inside these organizations, these bureaucracies. We passed a law in the state of Maryland to the Maryland Health Improvement and Disparities Reduction Act of 2012. All those policies mean nothing unless we are active on the ground. So let's create some businesses that create Orashore. Let's make sure that these organizations that have been committed to this work have the resources they need. And let's remember what Booker T. Washington said. If our leaders have no vision, the people perish.
I thought that was in the Bible. You keep saying that was Booker T. Washington. I'm a W.B. Du Bois man, but I'll say that for the next panel.
So it doesn't end here in many ways, literally too. And I just want to mention, you know, we should not judge the room just because we don't have a lot of staffers here. The good thing is this isn't the only HIV/AIDS panel here at the Congressional Black Caucus Foundation's annual legislative conference. Okay? So we had one before this. We had one before this with Congresswoman Barbara Lee. And we'll have a reception after this that will honor some of our black leadership that have been in this fight. And that includes Congresswoman Barbara Lee, Congresswoman Maxine Waters, Tommy Deutsch from the 100 Black Men, Chairman Emeritus, and Reverend Calvin Butts, and Black Entertainment Television with their Wrap It Up campaign. So I will ask you to join us in room 201. I also want to mention the fact we talked about stigma, and the Congressional Black Caucus Foundation has partnered with most of the people here on this panel in one way or another. We partner all the time with our 19 or 18 other partners and ally. And I want to mention the Stigma Conference here at Howard University. It's our third year. We worked with Howard University Hospital, a bunch of doctors and nurses that put this together, which, I mean, they took it on their own. Nobody helped them. I mean, we were talking about they're working with their patients and they're trying to do a conference at the same time. They don't have staff that have separate duties just to do this conference. Everybody is wearing 5 hats to get this done. It is the International Stigma Conference on HIV. It'll be November 30th. It's free. They ask for donations. I've never met so many dedicated people in my life. Literally go around the hospital and will, Dr. Rana at Howard University Hospital is no joke, okay? He will go around to every doctor and just say, well, can you give money? I mean, he literally raised like $15,000 just from his colleagues by keep asking them and asking them until they give. And so, again, please go to the website, whocanyouTell.org. We also live stream this around the world. Each year, we've almost gotten 1,000 people from all over the globe. That's just internationally to attend this conference. So please join us. And again, I just want to give a shout out to our partners. I know I keep saying 19, so let's actually hear their names before I say goodbye, and we can head over to some food. We'll start with 100 Black Men of America, American Urban Radio Networks, Aspira Association, Black Men's Exchange, Black Women's Health Imperative, Congressional Black Caucus Foundation, Farm Worker Justice, International Federation of Black Prides, National Action Network, National Association for the Advancement of Colored People, NAACP. National Council of Negro Women, National Hispanic Council on Aging, National Medical Association, National Newspapers Publishers Association Foundation, National Organization of Black County Officials, National Organization of Black Law Enforcement Executives, National Urban League, Sigma Gamma Rho Sorority, and the Southern Christian Leadership Foundation. That is your Act Against AIDS Leadership Initiative. I want to again thank our panelists, who I knew would bring this conversation to where it is. So thank you very much, and I will see you in room 201.
Hey, is it hot food or just snacks?
No, real food, hot, hot food.
You're going to order a photo shoot for all the panelists? A photo shoot for all the panelists?
Yes, a photo for us, yes. Ally partners,
decide where you want.
Could you come to the front?
Where you want the panelists?
I think we're going to attempt one right here and see if I can catch this man.
All right.
Don't leave.
Pull together, people.
All right. Okay. All right. Okay. Okay, but you can't, he's getting ready to take a picture. I want to have lunch with you.
Okay.
All right.